Subacute necrotizing sialadenitis is a rare self-limiting inflammatory condition of minor salivary glands, primarily affecting the hard palate. It mimics malignancy both clinically and histologically, but it is benign and resolves spontaneously within 2 weeks. Ulcer size is about 3 to 7 mm. They are small ulcers, and most of the cases reported till now are the males. These ulcers are commonly small, about 3 to 7 mm in size, round or oval shape, well defined, slightly raised erythematous margin are there. The exact cause is unclear, but proposed mechanism include local trauma, ischemia of the salivary tissue, ductal obstruction or infarction, or immune-mediated response. These ulcers situated on the posterior margin of the hard palate and often painful without any systemic presentation of fever, chills. So there is no systemic signs. DD may be mucoepidermal carcinoma, which is persistent growth or not self-resolving. Necrotizing sialometaplasia, that is histologically similar, needs biopsy to differentiate. Traumatic ulcer usually less deep and history of trauma is there. And malignant ulcer having induration and rolled margin, non-healing margin. On histopathology, there is coagulative necrosis of salivary lobules, inflammatory infiltrate with neutrophil and lymphocyte. There is preserved lobular architecture and there is ductal squamous metaplasia without any dysplasia. And there is no invasive growth is there. Diagnosis mainly on clinical suspicion having acute painful ulcer on posterior part of the hard palate and biopsy is done to rule out malignancy. Treatment is supportive only and prognosis is excellent in these cases. While necrotizing metaplasia is a benign self-limiting ulcerative inflammatory condition of the salivary glands caused by ischemic infarction of glandular tissue followed by squamous metaplasia of ducts and acini. Clinically and histologically mimics malignant tumors like squamous cell carcinoma, mucoepidermal carcinoma, leading to potential overtreatment if misdiagnosed. These ulcers are larger, about 1 to 3 centimeters in size, may be bilateral and having irregular and crater-like indurated ulceration. This necrotizing metaplasia commonly seen in male patient middle age having history of smoking, alcohol and local trauma. Main mechanism involve local ischemia, infarction of salivary tissue leading to necrosis with repair with the squamous metaplasia. Predisposing factors are local trauma, dental local trauma or oral surgery, smoking and alcoholism. Most common site is the hard palate, about 75% of cases. Other sites are soft palate, lip, buccal mucosa. These ulcers are gradually develop over 1 to 2 weeks and these are painless. Sometimes on touch they are mild tender. These are crater-like ulceration with irregular margin about 1 to 3 centimeter in size. You can differentiate this with by taking biopsy by squamous cell metaplasia, mucoepidermal carcinoma, traumatic ulcer, and subacute necrotizing sialadenitis. On histology, there is coagulative necrosis of salivary acini with lobular architecture is preserved. There is squamous metaplasia of the duct and acini and pseudoepitheliomatous hyperplasia of the overlying epithelium is seen. There is no atypia or invasive growth. For diagnosis, biopsy is mandatory to rule out malignancy. Histopathology is confirmatory. Treatment mainly supportive like saline mouth rinses and analgesia, and these ulcers mostly heal spontaneously within 4 to 10 weeks.